Hi guys. Well, I have COVID, and so this isn't going to be the most glamorous video I've shot because I don't feel very good. But let's jump right into how I knew it was time to get tested. So I have pretty bad allergies. I'm really sensitive to air pollution, and so living in DC over the last couple of years during this pandemic, I've gone back and forth of like, is it COVID? Is it allergies? Is it the air pollution? I'm constantly checking the air pollution levels and the allergy levels to decide whether or not it's COVID or allergies. The age old question now, right? So this time it was definitely different. I had all the normal cough and sore throat and headache that I kind of get when the air pollution is bad or the allergies are bad. But this time, what really tipped me off and I decided that I needed to get tested was that I had a low grade fever. And I know that doesn't sound like rocket science, but this one, when I started feeling feverish, that whole like hot and cold at the same time, just kind of chills. The heat was up at like 78, but I was still cold, but also still hot, that whole thing. Um, I took my temperature and it started out at like 99.1 and then 99.3 and then 99.5 and it stayed at like 99.6 for a few hours and I was just sitting there and that's when I really knew like, okay, this isn't allergies anymore. This isn't the air pollution. I should probably go get a test. Um, so, on top of that, specifically, the symptoms that I have seem to fall pretty in line with what they're saying for the Omicron variant, although I can't tell you exactly which variant I have. But I had really, really, really bad low back pain. Like, so bad that I thought that something was wrong with my back. And that was honestly started before I noticed the fever. Um, and then on top of that, I had pretty bad nausea. So right now, there's kind of this general thought process of like if you have all the symptoms of COVID with the Omicron variant going around, people say just assume you have COVID and isolate for 5 days, according to the new CDC guidance. Uh, and a lot of doctors right now will say, hey, you don't even need to get the test, just like isolate, do the right thing till you don't have symptoms for 5 days. However, I'm going to disagree with my fellow public health experts on the testing situation, and some people might get frustrated with me saying this because there's not a ton of tests available everywhere. However, I think that it is important to get yourself tested. Not all the time, but if you have an actual fever that persists for more than a few hours and you have the symptoms that I discussed, and here's why. There are a lot of viruses that have swept through a lot of places that have long term effects. And like myself, I had mononucleosis when I was a child. And that comes with, you know, a possibility of lifelong effects from having it. And that could be the case with COVID as well. And I'm not here to scare anybody. I'm just here to say that being able to say, like, have in your medical record that you had COVID um, can possibly clue doctors in later in life to things that might be going on because we don't know what the future of COVID holds. So if you can and you have the symptoms that, they're saying are going with COVID right now, then do get tested. I know that's easier said than done. I had a really hard time finding a place that I could go get tested. And I actually wound up having to pay $65 for administrative fees. Even though I have really good health insurance and the health insurance paid for the test, I was charged $65 to have a PCR test returned results in 24 hours. So that's very frustrating. And I understand that it's not possible for everyone. And additionally, when you're sick, and I am telling you, I have no energy. Walking up the stairs feels like I ran a marathon. I did not want to call 10 places to figure out a place that could give me a test, but I knew how important it was for the future of my healthcare. And so I did find a place and pay the $65 to make sure that I had an actual diagnosis and a piece of paper to go in my medical record that said, yes, she had COVID. Okay, so the last thing I want to talk about is my son's symptoms. My son just turned 5 3 days ago, so he's not vaccinated yet. And, you know, even as a public health expert, I missed out on some key symptoms from him. And number one, he had a rash. And my kid gets rashes all the time. All kids do. They're very sensitive to chemicals in their environment. They're very sensitive to the elements. So he gets rashes a lot. And, you know, we take pictures and we measure and we track them and we just sort of make sure that he's okay. Well, this time he had, sorry, COVID. This time he had a rash on his forearms. Here's a picture. It was pretty red, and it was pretty distinct. However, it looked like where his forearms would have been in contact with the table at school. And I just assumed that they were using harsh chemicals to clean because of COVID. And so we kind of waited it out. We put him in long sleeve shirts. He wasn't really showing any other symptoms. Otherwise, we would have taken it more seriously. And I sent a message to a school and asked if they had changed their chemicals, and they said no. And that was about an hour before my fever started. And so as soon as those two things collided, the realization that he had a rash of like unknown origin and I had a fever, we scooped him up from his pre-K and went and got us both tested. I am happy to say that my son is doing great. He's doing much better than the adults in the house. And last night I actually laid with my head in his lap to watch his bedtime shows. So he's doing really well. So no fear of that. Anyway, I just wanted to go over what some of the key symptoms were that told me I needed to get tested. Later on, I'm going to do a review of the COVID home test kits, and it's really interesting how that turned out. Anyway, if you have any questions about anything that I've said, type them below and I'll answer you. And with that, I wish you all good health, and we're going to get through this. It's probably going to be here forever, but the levels at which it's in the population are going to drastically drop, and it's just going to live in the background of our world probably forever. But we're going to get to the other side, and we're going to do it together. And so have a great day, you guys.